So she had a graft, skin graft?
Meet Dr. Sherri Reutlinger. She's with the Refuge International Medical Mission from the United States. On her name tag, it spells out doctor in Spanish. But you see, in the States, she's actually pursuing a nurse practitioner degree. But in Guatemala, she's a doctor because of the position of nurse practitioner doesn't exist. She traveled with the La Crosse, Wisconsin Viterbo University nursing group that consists of 4 postmaster students pursuing their nurse practitioner's degree and 4 faculties. This program is designed to help students such as Sherri get hands-on experience they can use.
It's been very beneficial for me in helping develop my skills and my critical thinking and diagnostic reasoning and just interacting with people of different cultures.
Before going to school to become a nurse practitioner, Sherri currently works as a clinical nurse specialist. She is pursuing a nurse practitioner degree because she wanted a change.
This is just going to allow me to do more primary care types of experiences and just broadening my scope of experience. I think I just see it as a growth potential for me.
Nurse practitioners can manage high blood pressure, diabetes, depression, and even prescribe medication. But for Kathy Ford, who's one of the faculties, she had a different reason for being a nurse practitioner.
I went back to school to become a nurse practitioner so I could work a little bit more independently.
That is what they're able to do on this medical mission. The faculties oversee the students treating the patients. One of those patients is Imelda Fidelia Toshkon. Imelda arrived with an ulcer on one of her ankles. She had fallen a while back and the area became infected. The doctor she previously visited in Guatemala suggested she amputate her foot, but she wouldn't have any of it.
Yo mi pie no voy a dejar aquí porque en verdad que mi pie me sirve, no, yo mi pie no lo voy a dejar aquí.
Sherri believes the foot can still recover, but having patience is key.
And oftentimes those ulcers are very slow to heal and slow to treat, can take a long time to heal, especially if they're of any size, but because she had not been able to get access to the medical care and the dressings and wound care treatments that she needed, it has really delayed the healing process for her.
Sherri did the best she could with what was available, but wishes the clinic had resources like wraps and dressing supplies to help treat the patients.
It was very difficult and challenging to have to tell a patient, well, this is what we know you need, this would be helpful for you, but we just don't have it to give to you.
Despite working under tight conditions, the entire team from La Crosse, Wisconsin was able to broaden their horizon in primary care and experience the difference in healthcare system between the United States and Guatemala.
We've been able to see and do and experience a lot of things in a short amount of time, so it really has facilitated our learning. It's been very challenging and kind of scary, to start off, like, how can I do this? But I think we've all felt tremendous growth.
Even though Sherri Reutlinger spent less than 1 week in Guatemala, she found that, despite the language barrier, she gained something that will last a lifetime.
Even though we don't speak the same language, a smile or a hug goes a long ways with these people, and it's just been that connection is, emotional and fulfilling.
Nurse practitioners has been a beneficial resource for this medical mission, as they've served more than 100 patients and sometimes even their families. From San Ramon, Guatemala, I'm Sangha.